Those of us who received the Moderna COVID vaccine, that's me and so many people I know, we now may just have a booster on the horizon. That is right. Breaking news, the FDA Advisory Committee is now recommending a Moderna booster. This is really exciting. I'm going to tell you exactly who this booster is intended for, how long those of us who are eligible for it will have to wait before we get that. Also, some information about the dosing of this vaccine, because it's a little bit different than, say, that with the Pfizer vaccine. Of course, and more. I'm Dr. Jen Caudle, guys. I'm a practicing family physician. I'm an on-air health expert and video creator. This is very exciting. I got the Moderna vaccine. I did document my journey with the vaccine. So if you've not seen those videos, make sure you check them out on Facebook and YouTube. And I also talked about the side effects that I had with Moderna as well. But this is what the FDA Advisory Committee is saying. They are recommending a Moderna booster, just like we have a Pfizer booster. It would be indicated for those who are elderly, those over the age of 65. Also, it will be indicated for people who are 18 and older who have a high risk of severe disease. Actually, both of those points are not unlike what we've seen with Pfizer. Also, it's going to be given to or eligible for people who are 18 and above who have, say, a high risk of exposure to COVID through their job, institution, living situation, etc. So that's also a category of people that will be eligible. That includes me as a healthcare worker. I then will be eligible for this booster should it be finally approved. And this, of course, is kind of like Pfizer as well. Those are the three groups: over 65, those with an underlying condition, 18 and above, that puts them at risk, and then those with occupational or living situation exposure or things like that also qualifies you, okay? A couple of details about this vaccine you should know is that you would be eligible for this vaccine, for this booster, 6 months after you completed your primary series, so after getting the first 2 doses of Moderna. So that's kind of like Pfizer as well. What's really interesting about this booster is that for Moderna, this booster actually would be a half dose compared to, say, the full dose, which is what we got for the first 2 vaccines. According to sources, this lower dose or this half dose for the booster is effective and potentially may have fewer side effects. I mean, that's what I've read, certainly in some different sources. We'll have to see what the case is and how that evolves and what data eventually shows. Let's see here. I also want to say, also, and of course we know the reason for the boosters, guys. We know that's because we know that protection does wane, of course, as time goes on. So this is really important. This still needs to be fully approved by the FDA, and then of course the CDC committee needs to sign off on it. But guys, it seems like for those of us who have gotten a Moderna, the Moderna series, that we will have a booster very soon, which I certainly hope so. And then of course we're waiting to hear about Johnson & Johnson and continuing information about Pfizer and all the vaccines, okay? So keep it locked here. Let me know what vaccine you got. Let me know if you got your booster already, which one you got. Let me know if you're going to get the Moderna booster when it's approved. Guys, I'm Dr. Jen Caudle. If you have not subscribed to my channel and click the little bell for updates, I invite you to do so. I do daily videos on all sorts of health topics, COVID, and more, so make sure you join. Guys, I'll see you soon.